Hi, welcome to Law and Justice with me, Jane Mulcahy. This is a special show on the topic of how to talk policy and influence people. And today I am really thrilled to be joined by Cissy White, who's in Boston. Isn't that right? Or in Massachusetts?
Yeah, right outside of Boston, South Shore, half an hour outside of Boston.
Okay. Well, thank you for joining me, Cissy. It's really great to kind of actually sort of virtually meet you because we were meant to meet in real life and then it didn't pan out.
This
So
is wonderful. Thank you so much for having me. I'm thrilled.
So Cissy, before we kind of get into discussions about ACEs and trauma and some of the work you're currently doing, can you tell me a bit about yourself and your background and professional stuff, please?
Sure. I mean, I think primarily I'm a writer, I'm a mom, I'm a trauma survivor, and that has influenced my work. I've worked in high tech publishing, and I've worked at an adoption agency doing cultural events for post-adopt families. And all of those things, I think, influence me. And there's a lot of overlap for personal and professional. And that's always been true for me. I think because I studied feminism in high school and college, and I um, completely live that idea that the personal is political. Like, I just think the personal and professional are completely overlapping. The personal and the political are very overlapping. So I definitely feel like I don't separate personal and professional, I think, as much as many people do, but I do have a background. Originally, actually, I was going to be a social worker. That was what I
Oh,
went to
that's
college
interesting.
for. And
Yeah.
I was the first person in my family to go to college, and I studied social psychology and critical and creative writing. And honestly, those three things, I think, for the last, now I'm in my 50s, and I still have interest in writing, feminism, social psychology. It's still all, and how those all intersect.
Well, something that I say a lot and have written many times lately is everything is connected, as you say, the personal, the political, the social. We might compartmentalize, and this is one of the things about, I suppose, living in a trauma organized world. It can be handy to compartmentalize and pretend that, say, as a professional, we don't know any of these social or personal issues that might be confronting us. But let's just talk a little bit about your writing, because you've a lovely blog called Heal Right Now. I've read many of the pieces there, and certainly they're very powerful and engaging and beautifully written. And one of them was about your discovery of the Adverse Childhood Experiences study. Can you tell me a little bit about what that was like, and what point in your life did you get this information?
Well, it's really interesting because it's fairly recent, and that's actually what has, so I learned about the ACEs study in 2014. It's the same year I started the blog Heal Right Now. I was in my late 40s, mid to late 40s, and I basically decided at that point that, and learning about the ACEs study was a big piece of it. So, but I decided at that point that I know some people heal like very quickly and early, but healing for me was decades long. I was diagnosed with post-traumatic stress in my early 20s from developmental trauma. And I had been, I'm in Greater Boston, so I had been to the trauma center, Bessel van der Kolk's trauma center. I had really what was considered, premier trauma therapy. And in those days, it was still just talk therapy was primarily what the treatment was. And you have to feel it to heal it was what the saying was back then. Although now we know that can be overstimulating and traumatizing, but that was the philosophy. And anyway, so in 2014, three things happened. I went to the trauma conference in Boston. It was the first time I had been to a professional conference, and I went as a writer. So I went as a writer and as a mother, because I was also an adoptive mom. So I knew a lot about attachment, and I was really interested in this conference, and it was close. It was near me. It was the first professional conference I'd ever been to. And it was about the 25th anniversary of the diagnosis of PTSD. And it was like, where have we come in the last 25 years? And it was all these big names like Bessel van der Kolk and Rachel Yehuda, Stephen Porges I saw there, Levine, like there was just all these big names that I had heard about. And yep, exactly. And I was at the time, I mean, I had read a lot about them because I had been healing forever. And so I went to that trauma conference. And one of the things at that conference was someone mentioned the ACEs. They called it an ACEs calculator.
Mm-hmm.
And I had never heard about it, but they said, if you haven't heard about this, you must learn about it. It shows the long-term and lifelong impacts of adversity. And I had never heard about that. So that was what clued me in. But also it was a 4-day conference. And at that conference, there was nobody speaking for 4 days from the perspective of a trauma survivor or at all in a first person. Right. So it was all they, them, clients. Yeah. It was very distant. And I was, I guess I was naive at the time. It was shocking to me. Like the books in the bookstore, everything was by clinicians. There was nobody speaking in a first person point of view. And it felt like it was uncomfortable as an audience member. I was like, oh, they're only talking about survivors as clients, not as professionals or parents or just people. Yes. And I was confused by where was the experience, because the conference was about 25 years, where have we come with trauma treatment? So to me, I just assumed that there would be people who had been treated for 25 years also saying, this is what the trauma treatment has been like. So for me, because I had been diagnosed 25 years prior, so that exactly had been me. I was like, this conference is for me. Like, this is 25 years of treatment and I've had it all. But there was, so for me, that was really puzzling, because I was like, I mean, imagine if Apple just only said what engineers think about what their products should do, but never took into customer feedback into account. Yeah. And that's what this felt like to me. I was like, why aren't people speaking about how the treatments have impacted them? So that's partly why I started the blog Heal Right Now, is because I was like, it's kind of invited myself to the table. Like I was a writer, but I was like, we need people speaking about this as people who are in the patient role, because we're in the patient role 1 hour a week, but the rest of our lives, we're not patients. Yeah. And we're talking about how to treat trauma from the clinician's point of view, but not how trauma treatment feels to the person being treated. That was completely absent. And I was like, why aren't there like panels with survivors and clinicians speaking about, here's what the treatment's meant to do, and survivors saying, yeah, that doesn't really cut it, or it doesn't come across, or that's not what translates, or this is really great and this was so effective and this worked. So I guess because of that experience, I found my voice and feeling like I could just start speaking up as a survivor, because that was the voice I wanted to hear and I wasn't finding it. So I just was like, we need somebody that will speak as a survivor. And of course, survivors are also professionals. And I know many clinicians are survivors.
Yeah, there you go.
But nobody would step into that in a first person way to say, I bring lived and learned expertise. Lived experience was kind of minimized as not professional or credentialed. And I was like, that is a valid perspective that's essential to, just as a checks and balances. Like, okay, here's what we mean to do by treatment, but that's not necessarily what treatment does. So I guess I was really interested in, how do you get treated for trauma and also parent and have a job and deal with health things and like have a life. And that treatment is just a piece, and it's an important piece, but it was a very narrow conversation, and that was surprising to me. So anyway, but back to the ACEs, I'm sorry, I'm going all over the place. When I learned about ACEs, that was for me, I didn't have a public health background. I didn't know, I had never heard the phrase social determinants of health. I didn't know what that meant. So when I learned about the ACEs study, what it did for me, I was in my 40s, and I know that a lot of people talk about the ACEs study and how shocked they are by how much trauma people have experienced. But when I learned about the ACEs study, I was like, there are 1 in 3 people that have had 0 ACEs.
Right. Okay.
That I was shocked. I was like, because I had gone through my life feeling like there's something inherently wrong with me. Somehow it feels like like lifing is just hard. And I felt like there's like some secret that other people must have that I don't have. Like, I don't know why this is so hard for me to just be in a relationship, sleep through the night, you know, like I just, things that were sort of basic, I knew were harder for me than other people, but I just thought something was wrong with me. So when I learned about the ACEs study, I was like, for me, it immediately gave me this visual of like, okay, there's people carrying grocery bags. And if you're carrying 8 grocery bags up a flight of stairs versus 1 grocery bag up a flight of stairs, more of those bags are likely to drop, things are likely to spill, and you're going to be in worse shape when you get to the top of the stairs. If you're carrying 1 bag, you know, you're going to have a hand free still, and you're going to have a little more breath. And it helped me understand that the burdens people were bearing in childhood weren't equal, were impactful. And it wasn't as personal as I thought, because the early days of trauma therapy also was about like, it's not what happened to you, it's how you respond to it. And I think the ACEs study, at least for me, pulled me out of my own looking inward and helped me look outward. And then, as I was also a parent at the time, so for me it was also like a parenting guide. It was like, as a parent, don't do these 10 things, because these 10 things are going to make your kid's life harder. And that was news to me. It might not be news to everybody, but I thought, when I learned about attachment and healthy parenting, I mean, I was not immediately a fan. I was afraid, like, if I do attachment style parenting, maybe my kid will be spoiled or not street smart or won't know how to handle herself. Like, and then to see a huge study and the lifelong impacts, that was convincing to me, because then I could step out of, okay, well, I know I want to parent differently than I was parented, but I don't exactly know. I know what I don't want to do, but it doesn't mean I know what to do. And that helped provide a framework of like, these are things to do and not to do. So in some ways, it was almost like the simplicity of a checklist, because in trauma therapy, a lot of what you're dealing with is you're diagnosed with symptoms as the trauma person. I maybe am dealing with dissociation or depression or anxiety, and that's helpful, but those are symptoms, not causes. The ACEs study helped me look at what causes those symptoms and what in their absence prevents those symptoms. And that was a missing piece for me, because I didn't know what optimal ideal development should be. Everyone in my family had a high ACE score. So it wasn't like, and we were all very different, and our symptoms were all very different. So it wasn't like I automatically thought, I just thought my life was dramatic or chaotic in childhood, but I didn't think it was trauma. I thought trauma was like
war zones.
War. My
well,
father
did PTSD as well, you know, the classic definition from the veterans. But Cissy, did it kind of help you then understand yourself a bit better and the challenges that you had over your life, and kind of have a bit more compassion, maybe, if it had been lacking?
Oh, absolutely. It still is why even though we'll talk about differences, I'm sure, about the ACEs scoring, but the information in and of itself was so profoundly powerful in terms of how I thought about myself, because I stopped comparing myself as, I saw, wow, like, okay, I have 8 ACEs, like, this is not what everybody is carrying. And this can cause challenges. And then I have much more compassion, like, okay, well, considering I've actually done okay, and no wonder certain things have been hard. And also, I want ease for my daughter and for future generations. And also, oh, my parents had all this too. So, the old school trauma therapy was like, okay, get rid of all your toxic relatives. And, it was overly simplistic. It wasn't that simple, because they had all had trauma too. So our family was organized around survival mode. And when I understood, and also that we did survive. So there was this feeling of like, okay, yes, there are symptoms, but we also did survive. That's not guaranteed. And then when I understood oh, not everybody survives. Like it reframed. I was stopped comparing myself to people who didn't have adversity or
Yes.
trauma. And I had been doing that. I had always been comparing myself and just seeing myself as lacking. So that was super empowering. And I definitely wanted to get the message out to other people, like, trauma causes an impact. And of course, it's going to wear you down. And like, for me, it was profoundly changing because I also stopped apologizing for what other people did to me. Like, it allowed me to release the shame. You know, like, I remember even talking about incest. When I came out talking about incest, people are like, you're so brave. You're so brave. And I would get so angry because I'm like, I'm only brave because there's still a stigma to being an incest survivor. And I'm being
taboo.
Yep. And I'm being judged for what someone else did to me. Like, that's craziness. So also the ACEs study, for me at least, helped me put that down and realize, like, I'm not what happened to me. I am not even responsible for what happened to me as a child. And I can speak about what happened to me and the impact that it's had, but not feel the shame.
Yes.
And that was a huge shift, because even going to therapy, though it was helpful, it was this feeling of like, I have to go to a room and pay somebody $100 an hour just to listen to me talk about my life, because in normal life, it's not appropriate. You can't really even talk about the things that have happened. I think that's changed dramatically because of the Me Too movement, because of social media, and the way that survivors can just find each other and bypass always going through, say, a professional to connect. And that's also powerful. But I think the ACEs study, it's like, oh, there's 17,000 people. And it just, for me, who didn't have a social public health background, I just really could see trauma has impact. And then when it happens in childhood, and including neglect. And I think that's another really important piece that the ACEs study did, is that it included neglect and abandonment and absence, and, you know, living with what your parents are sometimes living with. I had never, I had been abused as a baby, and I didn't remember it. So I always thought that didn't affect me.
Okay.
So that was another thing that learning, like,
stuff.
So I thought, oh, witnessing domestic violence, even as a baby or a child, or experiencing violence that I didn't remember, I had always thought that didn't have an impact. And so that was also learning, okay, those things do have an impact, even if they're not remembered. And they're about experiences you lived through, not just how you did or didn't cope. And that shifted things very dramatically for me.
I was just going to ask you there, do you think the fact that ACEs and some of the work from the Harvard Center of the Developing Child has shown these very sensitive developmental periods, so especially the 0 to 1 as a massively sensitive period, do you think that might be why some people have difficulties with the ACEs science? Because it's kind of mind-blowing to think that pre-verbal stuff that we do not remember can be held in our body and can kind of come back to haunt us.
Yeah, I mean, I think there's a lot of reasons people have issues with the ACEs, and I think it depends, like, I guess learning about ACEs, it can open up a window that you can follow different threads at your own pace. I think when you learn about ACEs science and the ACEs study, I think where it gets tricky is if it's used prescriptively and everybody responds to it differently, and we need to make room for that. So how people learn about the ACEs study, when they learn about it, who they learn about it from. You know, like, if I'm learning about it from somebody who's saying we and are, it's very different than if I'm learning about it from somebody that's saying, what's your score? And is kind of using it to determine something. So I think it depends on the setting. So I guess the sensitive periods, I mean, for me, I know people say the ACEs studies can be triggering, or they worry that it's used by non-professionals, but for me, you know, silence is way more triggering than hard conversations. Avoidance and there's sometimes palpable discomfort with people if you're talking about trauma, and that doesn't feel good if you've lived through it and you know that people are just like my father was homeless and an alcoholic, and so when people would do on like a health survey, just a regular physical, and ask you about your parents, you could see it making the doctor so uncomfortable, like like they would just be like, you have therapy, right? Like, oh, like,
Yeah.
don't bring it to me, don't bring it to me. Like you can see their discomfort, and as a patient, you end up trying to make them feel safe. Like, yes, I've done a lot of therapy, or I've got it really handled, or it was a long time ago, or whatever. You're trying to make the doctor, like, they most of the time don't want to go there because you have 15 minutes and it's not something most doctors are trained on how to handle and deal with. So
no, for sure. I mean, I've had that experience myself at prior events before I really learned about trauma, when someone would stand up and say, I remember an elderly woman at a domestic violence conference stood up. She had no children. She was from the UK and moved over to Ireland and was horrifically abused by this man who was a pillar of the community for, 40 years of their marriage. And she was talking about the divorce and how it took place very quickly on the steps of the courthouse. Really, it was all wrapped up. And she just wanted people to hear her. She didn't give massive details, but I remember just how trauma is embodied now as well. I had no experience of this myself, but my stomach was going into knots and I could just feel it. She only probably spoke for 5 minutes, but it felt like 20, you know what I mean? And so, but what's interesting about that is, if that is how difficult it can be to hear certain things, what is it like to live through them and to be forced into silence, And Daryl Hammond in that great movie Cracked Up said the worst thing is being expected not to talk, really, and to keep it silent. Would you agree with that having gone through what you went through, say in your childhood and youth, the inability really to talk, or to feel that you'd be being disloyal maybe, or even not knowing that these things weren't okay, perhaps?
Oh yeah, I mean, I love Cracked Up for showing that, and I love that quote because a lot of survivors will say not being heard or believed is worse than the abuse itself. And I think that was definitely my experience, because even as a child, I don't expect someone that's abusing me to hear me or see me. But when other people who I think are good or maybe do have that capacity can't see or hear it, it renders you like you don't matter.
Yeah.
You don't expect someone who mistreats you to treat you well, but you do expect other people to. And when that doesn't happen either, it's like a 1-2.
Yeah.
I mean, they go together. They can't be separated. I'm not minimizing that, what abuse does, but I do believe that all that research about buffering after trauma, I agree with that, because there is a difference between being supported, heard, seen, resonated with, responded to, attuned to, attached to after something horrific, and not. And I think that's what we see when there's natural disasters, where people do rally and communities can grow stronger and people can come back. It's not that there isn't pain or loss or overwhelm, but it is different when there's a response that's compassionate, caring, validating. So I think for people that have experienced abuse in childhood, I think it is changing now, but the response isn't always positive. And in fact, I mean, I know we talked about, I was diagnosed with ovarian cancer a little over a year ago. And I always tell people, like, ovarian cancer is not, like, PTSD is 10 times harder than cancer, because with cancer, people respond.
Right.
Everybody's supportive. Everybody
knows
about it. People talk about it. People send gifts. People send money, people send stories, people have endless amounts of hope and experiences that they've heard. When I was diagnosed, I had people that I met one time, like offering to give me rides to chemo. I had people like this sweater somebody gave to me that I met one time at a conference. Like, people are so amazing and kind, and it does counter nausea or fear or anything. But what gives me hope is that I believe in 10 or 20 years, if somebody says they are diagnosed with PTSD, someday it will get that response. Right now, if somebody says they have clinical depression, schizophrenia, PTSD, they're overcoming an addiction, that is not the response they get.
Yeah.
It is not an outpouring of, oh my, you must be in pain. And how can we help and assist and support and lighten the load, not just for you, but your whole family.
Yeah.
And it's very much treated like you should keep that to yourself.
Yeah, right.
I'm sorry you're dealing with that, but you definitely don't need to be saying it or telling people. It is not like you're going to put that on your resume or your match profile. It is not like a winning thing. It's stigmatized still.
Yeah, it frightens people, I think, a little bit, or makes them back off because I guess they feel, well, there's going to be instability here, and behaviors that I don't know how to manage or cope with. But in terms of the other kind of science or discourse around resilience, you've also written about this, and I find your reflections on it very important. And I'd share some of the concerns because, frankly, people who survive multiple adversities with lack of buffers are very resilient, even if they do it through using drugs or alcohol, or other self-harming behaviors. What's your own take on resilience, or what's your beef with it, if you have one?
Yeah, I definitely do have a beef. I hardly ever use the word resilience. I do not find it a positive word. I feel like most of the time when people are talking about resilience, they want it to be, they mean you're resilient as in you don't seem like what happened to you.
Right.
You hide
it well.
Exactly. Right. And I think that's mostly what, in a way, I think it's a very acceptable form of victim blaming, right? Because it implies that there's a way to be abused or harmed or mistreated and it not affect you that much. And I think that we should be spending way more of our effort on preventing abuse rather than trying to find the perfect way to respond to it that is least damaged seeming.
Yes.
And that, for me, that's my problem with it. I don't think everybody uses it in that way, but I think it's often used in that way. When I started public speaking, all the time it was almost like if they heard you're speaking about abuse, they would say, you're going to talk about resilience. And I would feel like it was like the rush to resilience, and I didn't understand it. And I think it part of the problem is the discomfort with talking about, it's easier to talk about resilience than it is to talk about the abuse or what causes the need for resilience. And for me, I just think children should just be able to be children. I don't think we should ask them to be so darn resilient. We should ask them to be safe. We should work to make them be safe. I don't think resilience is the answer. And I also often think what we mean by resilience is really resources and relationships.
Yeah.
It's not actual resilience. The people that do well have usually relational resilience, I think, or relational resources, I think, as Bruce Perry says. And it's those resources that help people manage. And that's not about who someone is.
Yes.
And the other part I don't like about the resilience conversation, I do think it does victim blame. And I think that, and it's actually very similar to cancer. People talk about fight cancer, as though the people that died didn't fight hard enough. And I that's like not the narrative that makes sense to me. The
Yeah.
same thing with resilience. It's like, yes, there may be people that have been through horrific abuse and are managing, but that's not the point. Like that, yes, we should be sharing what gives us hope, what helps people survive, how people manage, how people heal. That's all really important. But those are things that can be taught and learned, and they're not personality traits. And it ends up sounding like it's almost like a certain type of person does respond and heal well, and a certain type of person doesn't. And it's less about the cause of the trauma than it is about how they responded. And again, I just think it skews the conversation. Like, where's preventing abuse and helping kids be safe?
Yeah.
That needs to be way more central. And then the other thing is, I remember Dr. Rick Hansen. I just love his work on neuroplasticity, and I love hearing him speak. And he was the first person I ever heard say PTSD is like he said, I remember hearing it, and he's like, congratulations, you have PTSD. It means you survived.
Yeah.
You survived. And you have to get PTSD, you have to have survived.
Yes.
And that is not guaranteed. It's not automatic. Not everybody lives through neglect or abuse and even lives.
Yes.
So your nervous system might be high wired and looking for danger everywhere as a result of what you've been through. But that's understandable. It makes sense. Your brain is trying to protect you. And that is a very different message, that you might have an overamped brain that's really working hard on your behalf, then there's something fundamentally wrong with you.
Sure.
And that reframing also has been profound, because it also allows us, like, we can heal whenever, like, and the things that we need to heal are the same things children need. Safety, love, support, being seen, being heard, being attuned with. And so instead of figuring out like, it just shifts to like, we all need those things. And when we all do better when we have them, and we all do worse when we don't. It doesn't always look the same, but it is kind of that simple. And that's a hopeful message to me.
Yeah.
Because we can all learn. And that also, as a parent, for me, it takes the shame away. I'm like, oh, now that I know this, of course I want to give it to my child. If I didn't know it, how could I pass it on? So there's less shame of what I didn't know. There's less blame, which allows for people to change and learn new things and have hope and not feel like I have to disregard my family. I can say they had a lot of trauma. I want to change things, but I can understand some of the things that got passed on to me were because they didn't know better. That's very different than I was persecuted, or I was bad, or something was wrong with me. So being able to change that generationally, allows for whole families to change, instead of making you have to be an outlier to survive, which is how it used to be. You kind of had to pull away from your family, pull away from your community, because it was seen as toxic. And that's where I think now, when we understand more about how whole communities experience trauma, not just families and individuals, if a community is under-resourced and a family is under-resourced, and then a family is under-resourced for generations, or traumatized, like in the case of slavery, I think we're finally talking about race, and we can say, oh, there's all this historical impact that has impacted where we are today. We can't separate. That's not a separate conversation. That's very central to the conversation about ACEs, about healing, because what healing means is going to be different depending what we've experienced.
Of course, yeah. It's a really important point, all right, that has kind of exploded because of the George Floyd killing in particular, and Black Lives Matter. And it's relevant everywhere, really, because white supremacy doesn't just happen in the States, or I mean, we have less of it here because our population of of people who came from Africa originally is smaller, but we still have plenty of racism to be grappling with. And I think the thing about safety is white people have no concept of what it feels like to be unsafe in their presence because your skin is a different color, you know. Now, women do have a concept of what it's like to feel unsafe in the presence of men, maybe, you know, but we do just need to know what bodies need to feel safe,
Yes.
you know, and how, as you say, essentially we are all the same. Whatever the differences, gender or culture wise, we do still need the same essential things to
Yep.
flourish and be
Yep.
healthy and to thrive. What's the atmosphere like at the moment in the States around racial justice and equity and COVID and all of that?
Yeah, I mean, I think it depends who you are, to be honest. I think some people feel like, you know, we're reckoning with race, and that word gets used a lot, reckoning. And I've also seen some people roll their eyes because it's like, we've been talking about this for a really long time. Oops. And it's a way overdue reckoning.
Yes.
I think, you know, I do think it has changed in terms of the more people are talking more often. I think they're talking earlier. People are talking about racial injustice. And I think people are way more focused on the impacts of racism. And in the past, it was more the talking about race as though there were, you know, at-risk populations and what I call at-benefit populations. We talked about at-risk populations, but we never talked about who's at benefit. You know, we talk about adversity, but we don't talk enough about advantage. I think talking about both race and class, we're also reckoning with advantage and privilege as well as adversity and discrimination and inequity. And so I think about time. It's about time. But it's also, I think we all have aspects that where we have privilege as well as where we have we've experienced adversity. So I think in the United States, I think a lot of us are dealing with where we've had privilege and white privilege, and maybe we've, like for myself, I maybe have focused most of my life and career on where I haven't had privilege. So now I'm also looking at, okay, well, what has this privilege given me, even as a survivor with a lot of ACEs who grew up poor? Because I used to think that most everything really was about class. Like it was I used to think, okay, it's really about like who's poor and who's not, and that everything could mostly be boiled down to access to money and resources, really. And now I have learned it's not that simple, that even wealthier Black women have lower, are not treated as well in a hospital setting, and poorer white women might have advantages when they're in a hospital. So I have definitely had to, okay, you know, I've made assumptions and I've made, I'm not looking at privileges and what that privilege has allowed me. So I do think people are doing that more now, and it's important and it's necessary. And it's not, I work at ACEs Connection and we're doing this as a team, and it's awkward, it's uncomfortable, it's difficult, because a lot of the times it's also realizing, what have I been doing? Like, it's embarrassing. Like I haven't been doing this. And then you were just speaking about my daughter's Asian. And I thought I was pretty aware in terms of privilege and race. But I mean, I just learn all the time how much I've made mistakes. I've made a lot of mistakes. And even a lot of times when she's had things happen at school that I've wanted to speak up, and she's like, Mom, don't. Like, even seeing that my ability to confront racism is a privilege. I'm going to be treated differently going to the principal than she is going to be treated with her teachers. And I've often been really ignorant. So it's it's a constant learning. I'm still learning. I definitely think our culture is learning. And in the States, for my daughter, I would say even more than COVID impact, even though she's schooling from home, seeing the protests about race, that's rattled her more deeply and also inspired her more than even how much COVID has changed our lives, which is enormously. But she's seen, okay, there's violence and fighting and protests, and that's really hopeful, but it's also scary because it shows how big and deep the problem is in the United States. So it's a lot of uncertainty mixed in with COVID of all kinds. Well, necessary but difficult.
Yeah, I can see how it would be energizing. It's energizing from over here, you know, because as you say, it's a long time coming. And for any child, I mean, even over here, children whose parents might have been from China were having to listen as well to racist jokes in the schoolyard because of COVID, and where, you know, there was an escalation of racial incidences on that basis. But I mean, one of the things that I have also learned from all of this discussion and interacting with so many people on Twitter, following people like yourself and Aces Connection, is, do you know what, it's okay if we get things wrong when we don't know any better, in a way, you know, not that ignorance is bliss, but once you know, once you have information about how we harm or can help heal one another, we're all then on notice, I think, to try and be better and have more compassion for those who are struggling, but even have compassion for ourselves if we do get it wrong, and try and make those relational repairs then, you know, because would that have been something that you'd have experienced maybe before, that, you know, if you were going through a tough time, and maybe were feeling ashamed or blamed for coping strategies, that sometimes even helping professionals, and teachers included, they don't model the behaviors that they expect children and struggling people to manifest. I'm thinking now in relation to criminal justice, where, you know, people are meant to have empathy for their victims and are meant to, you know, probation officers are meant to help people with pro-social modeling, but they don't always turn up on time for appointments. If a client misses it or doesn't turn up, you know, they could be hauled back to court. But just common courtesies, or even checking our behaviors again, and kind of thinking, how might this be perceived by a trauma survivor? And that's trauma informed too, isn't it? Presume everyone's a trauma survivor, and then you're going to improve your practice.
Well, I think, and I think, I mean, I love Donna Jackson Nakazawa. I know you follow as well. And I interviewed her once for Aces Connection and for an article I was writing. And she, I thought, made a really good point. She's like, we ask the most of the people with the least, and we ask the least of the people with the most. And she was talking about in terms of help, when we're getting help, you know, we have, say we have, like my mom was 16 when she started having kids. You're asking somebody with little kids and no car, who maybe works a double shift, to like get to a therapy appointment without offering tele or remote, without having the ability to come on a weekend or in an evening. Like, we gear all the services around the professional's convenience. Sure. You know, like, we don't gear it around, if I was in this situation, what would be best? What time would be best? You know, like, so you have like a lot of parents who, like, for us, we had the ER doctor was our doctor. We didn't do pediatricians. There was no well visits. I didn't even know people did that. Like, I was like, I thought you only went to the ER. I didn't even know people went to the doctor when it wasn't an ER, unless it was an emergency, unless you're like bleeding or something. Like, who does that? I didn't know anyone that did that. Like, because if my mother was a single mom and worked, like, that's when we went to the doctor. Or else, like, so anyway, we tend to create what we think is going to be helpful, but we're not asking the people we're trying to help often enough if it's at a time that's helpful, if it's in a manner that's helpful, if it's in a way that's helpful. And when I had with little kids, the benefit of what you'd get out of 1 hour of therapy as a parent, if you have to manage childcare, driving, rides, never mind money, all that,
It's stressful.
yeah, how much do you get out of it versus how much stress it causes to get there? And that we don't, like Laura Porter in the self-healing community, she was talking about how the women, infant, and children with the WIC program in California, in Washington State, they realized that if they had appointments, a lot of them were missed. But if they had a drop-in day,
Right.
that anyone could come in and drop in that day, it skyrocketed. The number of people who, just because anyone could come anytime that day. And they also had childcare. So if you come and you bring your child, you can go to an appointment while your kid's in childcare. And it's like, you don't need to be a genius, but you do need to think about the aim of what your program is meant to do, who it's meant to do it for, and how to make that easier.
Yes.
And I think we're doing better with trauma-informed care in terms of understanding that many people can experience trauma in ways that we're not understanding. I think we have yet to change systems in a way that really gear towards survivors and center the experiences of survivors. There's more awareness of survivors, but I don't know that we've shifted to making things work best for survivors yet.
And does that then maybe need more survivors in positions of power within these systems to kind of allow for greater flexibility? For example, I'm working on a piece of research at the moment where these men who've experience of growing up in deprived communities and maybe drug-related issues and engagements with the criminal justice system in their youth are now peer mentors. They're paid peer mentors, but they go out and they do intensive outreach and bridging people then into services to meet unmet needs. And they're remarkable in their kind of heart-centered and person-centered approach. It's about the people and what they need and in their time. I'm just not too sure that all that many middle-class professionals who are not owning their own trauma history would be prepared to do the antisocial hours or some of the tricky work around that intensive outreach.
Yeah, and I think we've seen a lot of evidence that peer-led stuff and survivor-led stuff is effective, but it's not often paid anywhere near the same that that others are paid. It's not. We don't value it yet. So yes, I do think it's central. And I have to say, when I was in agony, and I would say with PTSD, I probably spent my entire 20s in like pretty much agony. It was like a fight for life. It was agony. And I spent my 30s somewhat in agony. And then each generation is like less of that. Each decade is less. But I didn't want to hear from anyone who hadn't, I mean, my kind of like refrain was, unless you've been through the same or worse, I don't give a crap what you have to say. Like, I just was like, you have no, like, I was
different
clear.
worlds.
Yeah, I was clear. Like, I know you mean well. I know, like, you have no idea what I'm talking about. And I often have no idea what you're talking about. Like, early therapy for me was literally like, here's what I mean by safe. What do you mean by safe? Like, literally just unpacking the words, because I was like, I don't understand. I do not understand what you're saying. So often I was like, that doesn't make any sense to me. I wore sunglasses to therapy. I hid my bangs. I couldn't even make eye contact for the longest time. Like, and I was like, you're talking to me like somebody that has been through something I haven't been through. And I would feel like, how can I bridge this gap? So I think peer support is essential. I think having trauma survivors, and it's like, so part of one of the things you had asked me before we got together was about community, trauma-informed communities and community development. And I think there are some beautiful models and there's change happening and it's really exciting. And I love how much sharing there is on Aces Connection and Twitter, and where people are learning from each other about what's going on. Like, it's super exciting. What concerns me is so many community-led initiatives are with professionals who are doing the work as part of their job or as part of their academic studies, but they don't necessarily live in the community where they're working. They are not the community they're speaking about. So that's going to be limited. Yeah. So what I always say to people when I talk about, like, because some people will say, we can't get any survivor input. We can't get any survivors to come in. We can't get parents with young kids. Like, I'll be on committees that we're talking about how to help prevent ACEs. And there's no parents with little kids at the table. Yeah. And I'm like, we need to be in conversation with the people we're trying to shape policies around. And if those people aren't at the table, not much that happens at that table is meaningful, in my opinion.
I agree.
And then people will say, but we can't get those people. And I always say, okay, so how much do you show up at a table on policy outside of your work or schooling? Just because you care passionately about it and want to make a difference and are flattered that your voice gets to be heard, that you get to be at the table, that is often uncomfortable, very biased, where people have very arrogant assumptions about your people. How often do you show up at those places to try to influence policy without getting paid, while it's in the day and you'd have to miss your work or school or parenting? Like, we still don't really do that. It's still mostly academics and professionals who are getting paid or getting credits who are doing a lot of this work, and hoping that it trickles down to community members. And I just think trickle down social change is as effective as trickle down economics.
So it needs, you favor more a bottom up approach, kind of. You use the beautiful phrase, it's not trauma informed if it's not informed by survivors. And I totally agree with that, you know, it's not going to work. It's not going to be relevant. It's not going to capture people's imagination and get them to buy in and wholeheartedly want to.
And it has to be partnership. Like, I think it can be survivor led, but also co-led. Like, I think it has to be in partnership. We have to be, and what we have to be partnering around is breaking down the private and personal, and professional. But what I mean by that is like, we all have to be there on a Saturday.
Yeah.
If we're talking about something we want, like, if we want something that is inspiring enough that you would show up because it's so beautiful and so healing and so important to the entire community, like, that's what it takes. But if it's only an initiative that's part of like a deliverable for your employer, and then me as a survivor who in the past maybe has been called non-compliant or has been punished or hurt by some of the systems that now want me to freely give my input and be just grateful to be at the table, not necessarily paid, not necessarily, you know, have any power, but just in a token position. Like, I think there's an arrogance that we still, the punitive approach, we're still dealing with the repercussions that many people have felt. So if like, we grew up and we had food stamps and you were shamed and blamed if you were like, it wasn't a comfortable, easy thing. It's not, to get people to talk and share openly, without defenses and without leftover anger. Like, we called people non-compliant who refused talk therapy. We now know talk therapy for trauma can make people worse. We didn't issue evidence-based apologies to all those people who said, this is not helpful to me. When I talk about my trauma, I feel worse. I sleep less. My symptoms get activated. We said they're not compliant. We said
treatment resistant.
Right. Like, and now we say, oh, it has to be somatic. oh, it has to be body based and you don't
Yeah.
even have to talk about your trauma. Like, we didn't ever say that. Wasn't shocking if you listened to survivors who said, I don't know, like talking doesn't help me, but like yoga does. What's
Yeah.
up with that? Like, I remember having those kinds of conversations. And if you said this isn't helping me, it should be, you should come twice a week,
Yeah.
not I should change how I'm treating you.
Yeah.
So for me personally, I love Bella Ruth Napperstack of Health Journeys because she writes about trauma and says, as a therapist, she could see that some of what she was doing wasn't helping people. And that's partly why she ended up exploring guided imagery and other types of healing things, because she's like, she was listening to her
Yes.
patients who were saying, it's not working, like this isn't helping, and then she responded and was trying to find things that did. And I feel like that humility and curiosity
Sure.
isn't leading the way enough. And then those of us who, like myself, who always considered myself an outsider, I also have to learn to put down like that anger, confrontational, like assuming bad intentions,
Right.
assuming somebody's out to harm.
Okay. That's
So
interesting.
I have my own biases that come from my experiences where I'm assuming a
Yes.
level of distrust at the get-go.
Right. Right.
I start that way. And I see other people like Rebecca Lewis Pankratz, who's much more about it's all of us. And she speaks so much about love and we all need healing. And I'm always, every time I hear her, I'm like, I want to be more like her. It's like, I want to be more like that. I start angry and confrontational still after all this time. And she starts with just like, we all need each other. We all need support. We all need more compassion. We all need more resources. Like, she's just got a different, it's just
Energy.
yeah. And it's more contagious, and unsurprisingly, people will respond to that and hear that, because she's also not like, I can go into, I've been shamed, so I want to shame the shamer.
Right.
I understand intellectually that doesn't work, but I still can get into this like reactive.
Yes, but I mean, this is another thing that's very useful though for people to understand about trauma, is that emotions are contagious, and that my dysregulation can make you dysregulated, even though you walk into the room in quite good humor. And shame is contagious and blame is contagious, and they're unhelpful, such unhelpful and uncollaborative emotions, for in terms of Porges's theory, polyvagal theory, and the importance of safety for health and social behavior and relationships. Once we get into the defensive zones, collaboration or trying to come up with the best solutions for whatever go out the window when we're in that kind of mindset, or it's not even a mindset, when we're in survival mode and unduly emotional. And so I think the mental health professionals and experts need to know this too, because sometimes they can get irrationally defensive about their power positions, because ACE's information are saying we need to listen more to survivors, or you might have caused harm despite your good intentions. It's kind of, I don't like hearing that.
Yeah, I think so. And for many of us survivors, we're I'll speak for myself. I can be reactive, even though I have benefited from traditional treatments as well as non-traditional. And so, we ultimately, I think, I like guided imagery. I listen to it every single day. I listened to it every single day when I was a new mom too, because no matter how much at night I would be like, I'll do better tomorrow, by like lunch, I was like hosed and doing the same thing I did yesterday. I would need constant voice in my head of soothing, calming, quieting, regulating. Like, I just could not get enough of it, because and then over time, that window of calm would get longer and longer and longer. But I still have to do it every single day to remind myself, like, that acrimonious relationship and confrontational and defensive as a trauma survivor, like I get that way with myself.
Mm.
You know, not even other people, myself. And I've had to learn how, like, okay, I'm not, I don't have to be at war with my parts.
Yeah.
I don't have, it's like, okay, there's an unmet need. And I think that's where like the Porges stuff too, of understanding just like what humans need, not like what you needed, just what our humans need.
Yes, what our nervous system needs to feel safe.
Yeah, and that can kind of like get people out of, like, I'm just a human, so it's less personal. It's just like humans need this. Humans, it's just a human thing.
And it should if this information finds its way into the maximum amount of people, you know, that's one of the things I love about ACEs Connection, is it's very democratic. It has people from various sectors, many different ethnic groups, and with special interest groups as well, you know, parenting with ACEs or whatever. But it's about getting the information to people who need it and can use it in their own lives and in their work. You know, what's it like working with ACEs Connection? It must be very exciting, I guess.
It is super exciting. And I have to say, like, I really admire Jane Stevens has a journalism background, which I think really shows on the site, because it's like very, she started ACEs Connection herself as a trauma survivor who was also a reporter and writer, who was shocked when she, like many of us, when we learned about it, how did I not know this? How have I been doing this work and how did I not know this? And wanting to make sure other people heard about it. So she, you know, she could have been retiring in her 60s, but, you know, like she's used some of her retirement to fund and get going for 2 years. Before she had any funding, she was just doing this on her own. She started ACEs Connection and ACEs Too High. So ACEs Too High is the journalism site that's open to the public, and ACEs Connection is a membership. It's free, but it's a membership site. And the only reason we require membership is so there's no cyberbullying. Everyone has to post. You have to post as yourself. And that's including the staff, everybody. You speak for yourself when you're posting, and that way everybody can contribute and post and share and comment. And I love it too, because you have the co-principal of the ACEs study on there, as well as someone that just graduated from high school. You know, like everybody's in a conversation and everybody gets to be part of a conversation and responding to the same post. That I absolutely love. But one thing Jane was really smart about, which I think it has been exciting to me, is she really believes that, like, for sectors to change, you need people in those sectors to be leading. So if it's criminal justice, you need criminal justice. If it's education, you need teachers and parents and students. If it's parents, you need parents. Like, so, I mean, it seems kind of common sense, but it hasn't always been done. So she really felt like these interest groups, there's somebody who's within that group who will have the ear and trust of the rest of the community. Like, for example, my ex-husband is the director of communications for the Mass Nurses Association in Massachusetts. And I've been talking about ACEs for a long time. He knew about ACEs, but when he heard from nurses speaking about ACEs and how it impacted nursing, that he heard in a very different way, because he was entrenched in the issues that nurses were going through. He could immediately see its relevance to the entire profession in a way I could never convey because I wasn't a nurse. So it's not like he wasn't listening, but nurses knew the language that would get his ear, because that is a profession that he's talking about all the time. And so one of the things that Jane does is she tries to bring people from various sectors to the table. And I would add, as well as sectors, now we're also bringing more populations. So we're not, it's also has to be diverse. To have equity, it's not just who there from these professional sectors is there, but who else is missing? Who else is this information important to? Who else is impacted? Who else do we need to have at our table?
Yes.
And so it is really exciting to work there. And I I was writing about parenting, and I would write in the comments all the time on ACEs Connection. And Jane emailed me and she's like, could you make this a post? Because I would write all these long comments, and that was in
That's how it
2014.
happened.
Yeah. And then I would start writing posts, and then I would start getting into more conversations. But that's how I got into working at ACEs Connection, just by being a member and having a lot of opinions, and then also wanting to be like, but what about parents? What about parents? How does this affect parents? And how is this particularly relevant to parents? How can we share information with parents? So yeah, I think ACEs Connection is really powerful. We have regional community facilitators who help support initiatives. So I used to be a community facilitator for the Northeast. So I supported 60 communities in the
Wow.
Northeast who are doing trying to make trauma-informed changes in either the organization or the sector or the county or the city or the state, and sometimes just within my family or myself. So
Yeah.
I really love that it's about making changes from the individual, family, or county, state, and then international, because it is a worldwide movement.
Yeah.
And we're all learning from each other. And there's definitely there's many different ways that people make trauma-informed change. And that's ACEs Connection provides a platform to help people learn what are the best practices, what are other people doing, what are all the ways that can happen.
One of the big debates, and I'm conscious of your time because we've chatted for ages, as I knew we would, but just on ACEs screening, which is a contentious issue, and it's something that I thought I was more sure about the benefits of it before than I am now, and I've learned from people like yourself. But what is your view as to its utility or its danger? Because I know Jane Stevens has said, whether we do the ACEs questionnaire or take an ACEs history or not, we need to make sure that this information is given to the people who need it, so that survivors learn this. So are they kind of two separate issues? Can we give people the information about ACEs without computing their score, or are there maybe benefits for people from having that done, do you think?
I mean, at least on our staff, there's a variety of opinions. So I speak entirely for myself on this one. I personally, until our systems are more equitable, I am not in favor of ACEs screening. But it's not because I guess I just worry that the education system and the medical system, the child protective system, insurers, the criminal justice system, I don't trust it's not going to be information that's weaponized.
Right.
I know, as somebody who has PTSD in my chart, it doesn't always mean I'm treated better. I think it can mean I'm treated worse. And I do think if we can label, it can be another label. We don't, at least so far, we do stigmatize people that have been through trauma. So I am not convinced that our systems have changed sufficiently enough to not be punitive. I worry that more people will end up in child protective services if the parent has a high ACE score, instead of getting support, instead of getting help. I think for the most part, not everywhere, but for the most part, if you are in a medical setting and it's revealed that you have a high ACE score, you're often referred out to behavioral health. That's pretty much what happens as a result. And I just don't think that's super helpful for a lot of people, because the behavioral health, the neurofeedback or hypnosis or EMDR or somatic based therapies, the things, neurofeedback, things that help the most are not even insurance covered. People will not necessarily get them. So it's not, for me personally, it's not like, okay, if I know you have an infection, I can figure out an antibiotic to give you. Like, there's that information to find out if you have an infection, and then there's an action plan. If we know someone has high ACE scores, we don't have an action plan that I feel like is sufficient. Like it's not worth the risks. I do feel like the risks of people getting labeled, harmed, and that information being used in negative ways are too high. That said, I have shared my ACEs score with doctors that I trust, but I feel like that's for a survivor to do in a relationship that they have. It's information I should lead if I'm sharing that. And there are times when that it doesn't feel safe to share that, and I still will not share it. There are times when I have to go in for if I have a medication appointment and it's a 10-minute appointment to get a medication refill, and somebody asks me about my childhood, I will just say, read the notes. Like, I am not going to in 10 minutes summarize my traumatic childhood and then leave here and go parent and work. Like,
no. Fair enough.
But that's in my 50s. In my 20s, I would have gone there and had a miserable weeks following that, because in a 10-minute appointment, how much relational acknowledgement, validation, like, I just don't, and I also believe getting screened and scored is different than having a sharing conversation. Like when Vincent Folletti talks about the health benefits of sharing your ACEs history, he was talking about people who wrote it down, who wrote it out, sent it to him, and then came back to an appointment, and he could validate and say, how did your ACEs impact you? He offered a lot of space and listening and empathy and time. And I don't hear in any of when scoring is done, we don't have systems that allow somebody to have an hour of time. We don't necessarily have, here's the supports you might need if we've identified these specific issues. So I think de-identified ACEs screeners are better in terms of are safer. But I think for the most vulnerable families, there's more risk than benefit. That's my feeling. I hope that changes, and I think it could change. But I also worry about like domestic violence screenings or depression screenings. It matters how they're done. When I go to my HMO and there's 10 minutes and I'm given an iPad and I have 10 questions, and it's like, were you suicidal in the last 3 months? Were you whatever? I don't know how helpful those are, or if people are just checking off like whatever you think you need to say to get your prescription filled. It's a drug run.
Yes.
And people, you have to sound like you have a little bit of enough symptoms that they keep the prescription going, but not so much that they want to do some intervention that's scarier. And I mean, that's how screenings can be.
Yeah.
And I think the way I frame it is always sharing information with people to let people decide what they want to do with it and how they want to use it is always going to be more beneficial than using information on people and deciding for people how this information can help them without them getting to have any input.
Sure. Again, well, that is far more trauma informed just right there, and empowering potential or choice and voice. If someone decides it has had no relevance in my life, well, that's for them to say, not for some professional to tell them they're wrong about, I guess. Just in relation to your own health issues, Cissy, have you found that the doctors are very knowledgeable about the links between cancer and childhood adversity and trauma?
Unfortunately, no. I mean, they're aware of links and correlations, but it doesn't translate into anything actionable, which I find really unfortunate, because I was diagnosed a year ago, August, and that next month in September, a study came out from the nurses study, and it was a correlation that there was a higher incidence of ovarian cancer for anyone that had experienced PTSD. And that was from the nurses study, and it was put out by the Harvard Chan Center in Boston. I may be butchering that name, but I can send it to you in the link, and I can send the article. But so there definitely was a correlation that if you had PTSD, you were at a higher risk of ovarian cancer. So I I asked everybody when I went to 3 different oncologists in the beginning, and I also had a surgeon, and they all were like, yeah, I'm sure that's true. Like, based on their experience, they felt like that was true, and anecdotally, and it made sense, but nobody, it didn't translate into doing anything different. Because I kept saying, okay, a lot of people would say, well, you're diagnosed now, it kind of doesn't matter. But I was like, there's a 70 to 85% chance of recurrence. So wouldn't getting better control of PTSD symptoms prevent relapse, or at least be somewhat helpful in preventing a relapse? So for me personally, I pulled out every PTSD tool, guided imagery, expressive writing, yoga, because I had actually stopped writing as much in the years that I had been diagnosed, personal writing, like expressive writing, in the years prior. So I was like, oh, I need to pick this back up again. And I need to do anything I can do to regulate my system, because PTSD in and of itself is a risk factor. But then people with cancer get, there's a high degree of PTSD just from cancer treatment.
Sure.
So people get PTSD symptoms just from that. So I feel like, and I may be contradicting myself, because in that way, I wish medicine would better understand the links. But if you're only going to label somebody, but it doesn't translate into anything that's actionable or helpful, I guess that's where I'd like to see the change. That somebody knows you have PTSD and says, okay, regulation is going to be even more important. Safety is going to be even more important. Communicating about the impact of treatments, like that means as a doctor, I need to give more voice and choice, and I need to share power more, maybe because there will maybe be more fear or apprehension or more physiological impact for some people than others to the treatments themselves. So that's why I do this work. I'm not for screening, but I still am for survivors teaching professionals, how to improve outcomes based on knowing their patients better. But I don't think you have to score to do that. I guess that's where I fall. I wish there were more research between understanding ACEs in childhood and or how childhood sexual abuse impacts GYN cancers in particular, or some of these things that are considered silent killers, that I don't really think are that silent. I think they're more silenced killers.
Yes, and that is the problem. That's partly why I think, well, at least if we started to routinely ask, then you build up information. Of course, as you say, the danger is it could be weaponized against individuals, or it doesn't go to improve practice. But at least if we systematically knew that there's this correlation between childhood sexual abuse and then ovarian cancer, if we could document this, well, then it's something you can't ignore anymore. It's not just anecdotal, it's not just individual, and then maybe it might lead to practice. But you also don't need to do ACE scores just to know that relationship and helping people feel safe is really important. And I don't think doctors get enough training. Stephen Porter said they get none. Gabor Mate says they get none.
And they have their own trauma, because I know Robin Kogan says, like nurses have a higher, average ACEs score. So, it's not just about how doctors will treat patients. It's about who becomes doctors, why people become doctors. And if people have their own experiences and aren't able to bring those with them in a way where we can acknowledge it or discuss how that impacts our interaction. I think for me, ACEs science, that's what Jane Stephen calls it. The science of ACEs, or ACEs science, and the ACEs study, for me, that's where the power is. And I don't think the scoring, it being so contentious and potentially being weaponized, I think gets a little too much airtime. And the benefits of ACEs science and trauma-informed change can happen just from learning about the ACEs study, but not just the original ACEs study,
Yes.
the work of trauma-informed community development, like Father Abernathy, or people that include race, that include poverty, that include war, immigration, that make it a way wider conversation that isn't just about trauma that happened in childhood. You could have an ACE score of 0 and have had a lot of trauma,
Sure.
and you could have an ACE score of 8 and have had a lot of buffering and privilege. Yeah. So we need scoring that can be nuanced, more nuanced than it currently is.
Yeah.
And that acknowledges that trauma can continue, for some, it continues in adulthood, even if it wasn't in the home, but it could be in the community. So I think being clear about what's the goal, which is usually more safety, you know, more wellness, more health and happiness for everybody. We can accomplish that with sharing ACEs science and information about inequity and health justice. To me, that's just more important. It's going to reach more people. It's less contentious. Yeah. So I just don't want to, I guess I'm tired of fighting over the scoring, even though I have opinions about it. If that makes sense.
Yeah. It is a bit exhausting at times, because it does take away from the great utility and the mind-blowing nature for people, I think, of understanding themselves and their families and communities better. One last question, Cissy. What 1 or 2 policy changes would you most like to see, I guess, in the States or in Massachusetts right now, that might, you know, have a substantial positive impact on individuals and families and communities' lives?
I guess it's not that original, but it's just having more, I know it's called like authentic community voice, but I think it's more, how Rebecca says it, Rebecca Lewis Pankratz says it is, those closest to the pain should be closest to the power. Mm-hmm. And I think that is a change that, if we made it, would make for huge policy change. If any conversation we had about any group with any problem is happening and it does not have that group who's experiencing that issue at the table, then that conversation should stop until those are at the table. And that, if we just changed only that, I think everything would change.
Yes, I agree. And do you think it's enough to, let's say, if it's dealing with racial issues and racial tensions and the legacy of historical trauma in the States, is it enough to have like one African American person at the table, or really should it be equal? You know, is an equal partnership important there?
Yeah, that's a really good question. I think no, I don't think I mean, a token presence isn't usually impactful, because it's very hard to speak up as a token. If you're the one person at the table, and the other people all know each other, which I've been like the one survivor at a table often, and I have left crying many meetings because of the things people say sometimes that they just don't know is really painful, and sometimes discriminatory that is said. So I think there's lived experience and lived expertise. And I guess what I would say is, you want to have, if it's, say, racism, you want to have someone speaking about the experience of racism. You also want to have somebody that understands the history of racism structurally and culturally, both. And I think often we have somebody speaking anecdotally, like me as a survivor, I can speak to what I experienced as a survivor, but you also want someone to speak in general about what's happened in the mental health community as a whole over 200 years.
Yeah.
You know, that experience is also important. Sometimes survivors can speak to it. Sometimes we can't.
Yeah.
But somebody at the table needs to understand the injustice and inequity and be speaking about that too. So it's about power. It's not just, to me, both of those are necessary, and we often talk about them as though they're the same. And I think some people can do both, whether they have lived experience or lived expertise or professional expertise. But I think that lived experience is too narrow, and that's why I don't use the phrase. I use lived expertise, because in what world is studying something in a book considered more expert than having gone through it?
Yeah.
And we act as though getting a degree confers a type of expertise that is superior. And we say expertise, we don't call that learned experience.
Yeah.
You know?
Yeah.
That's your learned experience.
Yeah.
You know, because that would be minimizing.
Yeah.
But we say lived experience all the time. And I feel like that reveals what people truly mean, which usually it isn't expertise. And I think it is. And we need to treat it as such.
And of course, the other problem is so many of these expertises anyway are compartmentalized and blinkered. You know, they know a lot about mental health, maybe through a biomedical model, but nothing about trauma or ACEs, you know, so there's the danger of that too. So the expanding the power base and the voices makes a hell of a lot of sense.
And we all need it. I mean, we all need to be listening and learning from each other. And it, you know, that is challenging, but it is where it gets juicy and good, and that's where the change happens.
That's where the magic occurs. Yeah, it's true. It's true. Well, look, Cissy White, thank you so much for talking to me today. It's been a real pleasure. I could probably go on for another 4 or 5 hours with you, because I know there's so many other things. Oh, one last one, because it occurred to me earlier and then I forgot. You wrote another beautiful piece, kind of to yourself as a young woman. I think you kind of alluded to the fact that you didn't want to talk to people who didn't know what you'd been through. And so it was kind of as though to yourself, this is what I wish someone might have told me, from an older self to a younger self. Why did you write that piece, Cissy?
I mean, did you ever read Rilke's Letter to a Young Poet?
No, I didn't.
Oh, it's a beautiful letter, and it's about like getting at peace with the questions that are in you and like learning to love those. And I think most of my life I was at war with my symptoms, and I felt like they were flawed and something to be eradicated and like hidden or stomped out or pushed away. And I think I finally realized, like, just show up as who you are, including your flaws. Like, be more open about that, because that's what I wanted. I wanted to hear people who are just talking about having a normal life after having trauma, and not normal life like, how did you manage a sex life? How did you manage work? How did you manage to learn how to trust people? Like, there wasn't anybody talking about the things that make, for me, like make a rich life. You know, being treated for trauma, if it doesn't do those things, I wasn't interested. I wanted to know, like, how do you stop being afraid? How do you sleep through the night? How do you settle a achy gut? How do you trust somebody when you're triggered? Like, all those things are really basic to being a partner and a parent and a person. And nobody was speaking about how trauma interferes with those things and how to get them back after you've had trauma. So that was what I really craved, and then wanted to share with younger people that because a lot of people write to me and they're like, I'll never heal. I'm so despairing. And I'm like, you can feel like that and still get to a point where you don't feel like that. Like, not to diminish what you're feeling. It isn't as hopeless as it may feel. So I wanted to go back to my younger self and be more comforting, instead of, I was kind of like military, like shape up and toughen up and kind of hide and cover, and just be like, there's nothing wrong with you. You don't have to be ashamed of what other people did to you, or that you have symptoms, any more than you have to be ashamed of vomiting if you have the stomach bug. Like, they're just symptoms. They're just symptoms. And can we relate differently to our trauma symptoms? That's really pretty much what my whole goal is in sharing.
And I read some of the comments, but did young people who were going through tough times, or still grappling with in the height of their own CPTSD or whatever, did they find that piece that you wrote kind of useful or helpful?
Yeah, that's what gives me the chills.
Yeah.
That's I mean, honestly, when people will say they love my writing, I always say, read the comments. If you love my writing, read the comments, because the comments people share, they're viscerally in it now, and they share from that place. And we don't hear those voices enough. There's very little places that are safe for that. And I think writing circles and women's circles, there's more places that are safe, but that's what makes people feel better. Just being able to tell the truth and say how hard it is in and of itself makes things easier. And often we think that will make people feel worse. It's not usually the case. If you're already in pain, having it acknowledged goes a long way. If you're in a good place, maybe it's painful to bring up painful stuff. But if you're in a pained place, it is medicine to be allowed to be in pain and seen by someone else who has also been in pain. So,
okay. Thank you.
All right. Well, so great to meet you and talk to you. And I can't wait to have curly long hair like you.
Yeah, well, I like the look. I think you're looking great, and it's been very special, Cissy. And thank you for everything that you do. It's amazing. It's powerful and transformative, I think. So thank you for your time. This has been How to Talk Policy and Influence People with me, Jane Mulcahy, and the wonderful I don't know, bubbly and kind of life-affirming Cissy White. Thanks so much.
Thank you so much, Jane.
Take care.